everyone. My name is Jam and I am a member of Group 1. Our group has 5 members. We will talking about the geology of fallot. I will introduce it to you all. The geology of fallot is a cyanotic congenital hair disease in children, although rare it occurs in about one of every 2,077 newborns in the United States. Despite this, it remains one of the more common congenital hair defects and says slightly more often in male infants. Today, we will explore an interesting medical mystery called the blue baby phenomenon, which is related to the geology of fallot. This question has puzzled many doctors and parents for years. Why do some newborn babies look blue or purple? In many cases, the reason is the tragedy of fallot. One of the more common cyanosis congenital hair defects. The blue color happens because the body does not get enough oxygen, which causes cyanosis. The tragedy of fallot makes up about 5 to 10% of congenital hair disease, and it can affect boys and girls. So sex have a similar risk of develop this condition. To better understand the causes of disease, I invite Mr. Lab to present his findings.
Now we go to the number two. Etiology of the first court is the displacement of the cornal septum. During every honest development of victory to which I of pregnancy, the cornal septum gradually from to divide the common arterial chunk into the aorta and the pulmonary artery. However, in tetralogy of fallout, this septum is anter-superior displacement called conosectum. This displacement onto the normal separation of the large vessel and the element of the upper part of the vascular septum, leading to four defects that disrupt the normal fluid flow in the heart. Besides that, there are other causes related to Down syndrome, genetic abnormality, such as Down syndrome called Chromosome 21, and family history of the tetralogy of follow or other congenital heart defects. Not only that, we have the Jack syndrome called deletion of the chromosome 22 and correlated to environment and pregnancy. The mother is infected with virus during pregnancy such as Ebola. The mother has diabetes and the mother used alcohol and tobacco during pregnancy. And to understand these defects in more detail, Doug will explain them to everyone.
Now, I will talk about the number three. For main defect of TOF, the name tetralogy of flow comes from four characteristic anatomical abnormalities of the heart. The first defect is ventricular septal defect, with a lock opening between two ventricles allowing blood to mix between the right and the left ventricle. The second defect is overriding outer. The condition can vary in degree. In some many cases, the outer is displayed to the right and sit directly above the ventricle septal defect. However, in some cases, it might be positioned more toward to the left ventricle, regardless of the exact position. If the oxygenated blood flows from the right ventricle to the left side, it can enter the synaptic circulation through the outer, and at the same time, the outflow tract from the right ventricle to the left lung is narrow. This abnormality is known as pulmonary stenosis. It might occur at the pulmonary valve or in the vestibular region just below the valve. In either case, it makes more difficult for the blood to reach the pulmonary circulation. And the three abnormally create increased pressure in the right ventricle. Over time, as right ventricle work against this pressure, the muscular wall caretaker, a condition known as right ventricle hypertrophy. This enlargement can give a hurt a bush shape on chest X-ray. The combination of four abnormality from the tetralogy of fallot, and this is the four characteristic anatomical abnormalities of the heart. And now let's move on to the next part of physiology.
Hi, I'm Ling. Welcome to the part 4, pathophysiology. In tetralogy of the blood, the two defects that have the most important effects on the hemodynamic are ventricular septal defect and right ventricular outflow tract obstruction or pulmonary stenosis. In the right ventricular outflow tract, obstruction can occur at the infundibulum of the right ventricle or at the pulmonary valve. The severity of this obstruction is very important because it determines how much blood can flow from the right ventricle to lungs for oxygen exchange. In the right ventricular outflow tract obstruction, they have two cases, mild and severe. In the mild obstruction, the pressure in the left ventricle is higher than in the right ventricle, so oxygenated blood from the left ventricle passes through the ventricular septal defect into the right ventricle and then bump into the pulmonary artery. Because blood still reaches the lung for gas exchange, the patient may have little or no cyanosis clinically. However, increased pulmonary blood flow over time may cause pulmonary congestion, leading to shortness, breath, and recurrent respiratory infection. In contrast, in severe obstruction, right ventricular pressure exceeds left ventricular pressure. So, the oxygenated blood then passes through the ventricular septal defect into the left ventricle and enters the aorta, resulting cyanosis. And finally, two other abnormalities are ventricular septal defect and an overriding aorta. These defects allow fluid from the right and left ventricle to mix, and the aorta receives blood from both ventricles, resulting in low oxygen level in the peripheral blood and causing cyanosis. And next time tell you the complications.
Everyone, and my name is Doi. And finally, I would like to present the complications of the tetralogy of Fallot. Well, the tetralogy of Fallot is cyanosis congenital heart disease that causes abnormalities in the heart structure, allowing oxygen-poor blood to enter systemic circulation directly instead of going to the lungs to receive oxygen. As a result, the body experiences chronic hypoxemia, which may lead to a variety of clinical consequences and serious complications. Some of the complications of the geology of fellow can be arranged according to their levels. It includes four levels. The first is mid severity. Next is moderate severity. Next is severe complication. And finally is very severe. And of course, each level will lead to different consequence. Like talk about the first consequence, mid severity. It also have cyanosis and hypoxemia, delay physical growth. About the moderate severity, we have polycythemic, and next we have severe complication. It have infective endocarditis. And about very severe, we have heart failure and brain abscess or stroke. So there are the common consequences and complications of the geology of fellow. This it also brings us to the end of our presentation. Thank you for all your attention.